Wanted to tell you guys about German New Medicine, and I'm reading from learninggnm.com. I will put a copy of the online link in the description of this video. Okay, so German New Medicine refers to the discoveries of a German doctor, Dr. Reich Hamer. He was, practicing in the 70s and 80s. And it says here, what Dr. Hamer found was that every disease starts with a shock experience that catches us completely off guard. He called such an unexpected event a DHS, a Dirk-Hamer syndrome. He was named after his son Dirk, whose sudden tragic death initiated Dr. Hamer's own cancer. Such an unanticipated event doesn't always have to be spectacular. It can simply be triggered when we have a failed important exam or when somebody hits us with a harsh remark. It is important to understand that a DHS differs greatly from a psychological problem. A DHS is a biological event that not only occurs in the psyche, but simultaneously in the brain and on the corresponding organ. At that very moment we suffer a DHS, the conflict shock impacts a specific brain area, causing a lesion that is clearly visible on a brain scan as a set of sharp target rings. Since each area of the brain correlates to a particular organ, the location of the brain lesion determines which organ will be affected. In other words, specific biological conflicts cause specific physical responses in the body, such as cancer, diabetes, asthma, heart disease, and etc. Based on our knowledge of the evolution of man, Dr. Hamer discovered these responses were programmed into the brain as a result of a biological adaptation process that took place over millions of years. Since every human being is born with these age-old programs, the German New Medicine refers to them as biological special programs, in clear opposition to the term disease, which implies a disorder and malfunction of the organism. So it goes along with, this is me just talking now, not the article. It goes along with the terrain theory of, our bodies are innately designed to self-heal, self-cleanse, and there is nothing wrong with our body when we are going through something causing dis-ease and symptoms. It is not the bacteria present that is the root cause. So Dr. Hamer is saying that, the root cause of disease can be linked to a, shock experience, trauma. He did a lot of, I've done a little bit of research on him, but not a ton. So I'm not an expert and I'm not a practitioner of this or anything like that. I find it super interesting. It fascinates me. So he did a lot of tests. He's a doctor and he was able to ask his patients questions. So his sick patients, he was able to question them. Did anything traumatic happen to you? Anything, he was finding out, a lot of them had things happen where he could link it and take brain scans and do all these tests. So it's not just a hypothesis that he had, like he was actually proving it with these scientific tests. So it goes on to talk about, this is also very interesting. I learned about this. I don't know if I learned about this maybe a couple years ago, the first time I ever read about this, and women, specifically for women and breast cancer. And it made sense to me. Okay, so here's what it says. While the glands of the breasts are affected when a woman suffers a nest worry conflict, the milk ducts will react when she encounters a separation conflict. Example, if her child or her mother or her partner was torn from her breast, separated from a loved one she intensely cares for example. Since the milk ducts are controlled by the sensory cortex in the cerebrum, the tissue will respond differently. During a conflict active phase, the milk ducts show small ulcers with the biological purpose to widen the diameter of the ducts to aid the discharge of milk. That is no longer required. As soon as the conflict is resolved, the ulcerated tissue will be replenished. Conventional medicine calls this cell proliferation that occurs during the healing phase intraductal carcinoma, breast cancer, right? German New Medicine offers a different view. After having carefully observed nature's biological laws for more than 2 decades, Dr. Hamer can assure us that such a healing tumor is a harmless lump that will slowly degrade during the healing process. Wow. I mean, that is really interesting, because in conventional medicine, they want to biopsy the tumors, they want to cut it open, they want to cut women's breasts off, give them chemotherapy and radiation and all. Wow. This is really, really interesting. Now, Dr. Heyman did pass away, but his work and his research still goes on. There's a lot of people out there, a lot of other doctors and practitioners that have taken his research and are rolling with it to help people. I just wanted to put this out there, in case there was anybody who'd never heard of this before. You can do your own research, look into it, and see what you think. Obviously, I'm not here to sell anybody anything. I just think this can help people, because if this is true, and I believe personally that most cancers are a healing phase of the body. The body knows how to heal itself, and conventional medicine they don't understand that concept, and they just want to throw poison at your body to try to attack these, cells and these tumors and everything. And what ends up happening is just you're getting poisoned, and it's not healing. It's not helpful. It's harming people. So yeah, I just wanted to get this information out there. There is a lot more on here I could read to you, but I'm going to post the link, and there's some other articles. You can even look at some charts on this specific one that's relating to, specific diseases. It's very interesting. The mind-body, for sure, the mind-body connection is very strong, and no doubt about that. Thanks for watching.